Welcome to the first All Things Poop webinar. And this webinar is for you if you don't have a bowel movement that happens easily every day, that is formed, brown, and has no foul odor. If you regularly get heartburn, this webinar is for you. If you feel indigestion, belly bloating, experience gas, or anything that is foul, fermented, putrid, either in stool or gas, this webinar is for you. If your appetite varies wildly and you want to know why, this webinar is for you. So let's start by talking about why I care about poop. It is one of the easiest ways for us to look inside what's going on in your digestive tract and to give us information about how healthy or in balance it is, or how irritated and out of balance your digestive tract is. So poop is just a nice indicator. It's just something that we can use as kind of that barometer of how imbalanced are you? Are you making progress? How does your body seem to be doing in its digestion, absorption, detoxification, and elimination? Let's talk about irritable bowel syndrome, IBS. Why I like to focus on IBS is this. The diagnosis itself in mainstream medicine is just a descriptor of symptoms. It says basically we've ruled out everything else that mainstream medicine knows how to rule out, and yet you still have either diarrhea or constipation or both. And then you get the diagnosis of irritable bowel syndrome. It is a descriptor. It doesn't tell us why. I'm interested in the why. I'm interested in, from top down, are you not chewing well? Are you not digesting well in your stomach? Do you have maybe low stomach acid, either production or pH? Is it digestive enzymes that's an issue? Is it that your nervous system is so upregulated and hypervigilant that your body is not paying attention to core functioning? If a tiger were in the corner of the room, it would not be a priority for your physiology to digest and absorb your lunch. Everything in your core would be powered down so that you could fight or run or scheme or curl up in a ball and overwhelm. It wouldn't be prioritizing digestion of your lunch. So your nervous system state influences whether you get an IBS diagnosis or not. Your level of movement, your level of hydration or dehydration, your physical musculoskeletal posture and what's tight and what's lax influences your bowel movements. The gut bacteria that live in your digestive tract influence your bowel movements. So when someone gets a diagnosis of irritable bowel syndrome or IBS, I'm exploring all of these things: bacteria, hydration, food, fiber, movement, posture, nervous system state. Rarely do I put someone on a therapeutic diet that is restrictive and have that be the only thing that's going to, quote, heal or cure their IBS. Their IBS is going to be explored on all of these different levels to see really what are the underlying causes of one single person's individual IBS. Why do I not do a restrictive therapeutic diet for people? First of all, I think we're all brilliantly designed and that we don't have to be 100% perfect. That's the first reason I don't use a restrictive therapeutic diet. Secondly, is it's not just about the diet. And so as I've just discussed with all of the different other things we explore as underlying contributors or causes to IBS, if we put someone on restrictive diet, let's say we remove all fermentable foods, all the most common irritants and allergens and have them on a very restrictive elimination diet or a FODMAP diet or something therapeutic and somewhat restrictive. In almost all cases, we have then a person who gets stressed out, feels bound, feels restricted, feels denied. And what does that do to a nervous system? Totally amps us up. What did I say was one of the main contributors for IBS? Nervous system upregulation and stress. What do you think happens to many people when they try to go on a restrictive diet? Their stress goes up and their IBS symptoms get worse. And then they're incredibly frustrated because they think, wow, I'm being this restrictive and I'm not eating all the things that I like. And not only am I not feeling better, but also I'm actually feeling worse. It doesn't set people up for success. So I do discuss food, and I discuss minimizing and emphasizing, and we discuss fiber and digestion and optimizing digestion and managing nervous system and moving the body and addressing musculoskeletal imbalances. However, I don't recommend that anyone is restrictive because I believe that that works against us. And so I want to take a little pause. We're just about 10 minutes in, and welcome y'all for attending. If you have any questions, you can do one of two things. My preference is that you put it in chat, and you can select the little down arrow next to the host and panelists. If you just want to send something to me, then it would just be hosts and panelists. If you'd like to send something to everyone, then you can toggle it to everyone. That would be my preference. You can also use the Q&A button that is also located down where all the other pop-ups are. That just requires that I'm paying attention to too many places for my comfort. So I probably will check that at the very end to make sure nothing comes up. But I want to make sure that I'm seeing things as they come, and that's where the chat comes in. So for those of you who joined us late, this is the first intro webinar, All Things Poop. I'm Dr. Wendy Lee White, licensed naturopathic doctor, nutritionist, and educator. And I do take a different philosophy than many practitioners to IBS. I don't want people to get attached to their IBS diagnosis because in my experience with my patients and clients, it doesn't stick around for very long. And so the reason I use poop as kind of a barometer is that it's a snapshot into the digestive tract without any invasive procedures. It can give me information about digestion, absorption, and elimination. So if you are someone who is having any digestive tract issues, now remember our digestive tract is a tube that goes from our mouth to our anus, and it is just that. It is just a long tube that has a bunch of twists and turns and bends in it that is useful for digesting, absorbing, feeding good bacteria or bad in our large intestine, and dealing with managing fluid balance and elimination through our stool. So there's been some posts on Instagram, please follow me there if you don't already, where I've been discussing kind of, does your poop look like this? Then maybe consider that. Does your poop look gray? Let's look at your bile absorption. So we have some things that we can learn from your elimination. So these monthly webinars are going to be in the format that I'll kind of give an intro at the beginning of each. And then I will open it up for questions or comments or anything else that someone might have to say. And so let's talk again about the idea that IBS is a descriptor, and it doesn't tell us anything about the underlying reasons why someone could have the diagnosis of IBS. Now, irritable bowel syndrome is just a descriptor. It tells us that you're experiencing either diarrhea or constipation or alternating both. Now, people can get attached to that diagnosis and say things like, oh, well, my IBS prevents me from doing X, Y, or Z. Now, I completely understand that when you're experiencing gas, bloating, urgency, diarrhea, foul, putrid, fermented smelling gas, that it's inhibiting your social health. And I want to make sure that I'm not minimizing. I understand that how impactful this can be to your lives. And I'm encouraging you to know that it's not just about the food. So I want you to take a moment to kind of connect to where you are. If you're driving, sitting, standing, laying down, just take a moment to take a nice deep breath, as if there's a birthday balloon in the bottoms of your lungs. Take a long, slow inhale, and then exhale. This technique of taking long, slow, deep belly breaths, 3 to 5 breath cycles minimum, helps us to switch from sympathetic nervous system, which I always wave my hands in the air of like the that's the upregulation, stress, fight or flight nervous system status. This type of breathing, this slow, deep, rhythmic belly breathing, is what helps our nervous system to switch towards the rest and digest part of our nervous systems. This type of breathing is something I recommend to anyone who is running into digestive issues, whether it's upper GI, heartburn, indigestion, gas, bloating above the belly button, or lower GI, gas, bloating, indigestion, constipation, diarrhea, etc., below the belly button. This type of breathing will help to support our nervous system to switch from sympathetic to parasympathetic. This type of breathing can really help us decide if the nervous system state is a large contributor for your particular IBS. By doing these 3 to 5 belly breaths upon wakening, before each meal, and before bed, when doing 3 to 5 deep belly breaths at least 5 times a day for at least a week, and seeing how your digestive symptoms respond, that's going to give us information about whether your IBS is really contributed to or caused by your nervous system. Wouldn't you rather spend some mindful time breathing 5 times a day, every day for a week, and seeing how your digestive tract responds to that, than automatically jumping to a restrictive therapeutic diet? Now, again, I'm not trying to say that we don't have to do dietary modifications in order to help a lot of people with digestive dysfunction. However, there are so many of these things like movement, posture, hydration, bacteria, state of nervous system. There's so many other things for us to explore before we create added stress and before we put you on a therapeutic diet that is going to then stress out your nervous system even more and potentially feed your IBS symptoms. So for those of you who just joined, welcome. Please do put any questions you have in the chat section. That is something that I have on the side of my screen and I'm watching. You can also add questions in the Q&A section. That's just a little bit harder for me to have too many things open in the screen to have to pay attention to. So the way I intend the format of these monthly webinars is that I will discuss kind of a little bit of my philosophy and my science. So we've talked about irritable bowel syndrome being a descriptor and not telling us anything about the why that it's happening. We've talked philosophically about all of the things that I like to explore being contributing factors or underlying causes of any given person's IBS. And I've given you one thing to try to play with to see how doing deep belly breathing soothing your nervous system can actually help relieve and balance your digestive tract and take away some symptoms of imbalance that you might have. So there, I'm going to open it up for questions. If anyone has anything to discuss, please put it in the chat. And again, you can choose the drop down either host and panelists or everyone. Everyone obviously would let me plus the rest of our guests here see that. If you want it to just come to me, that way no one else sees your name and the question you're asking, you can submit it anonymously just to host and panelists only, and then I will reply. So here's a question from Ken, and he says, what about, sorry, I have to read the whole thing before I can summarize. So the idea that an IBS diagnosis is forever, I don't believe that it is. I've seen that it is not. I've been practicing for 14 years. And while some people can get quite attached to their diagnosis, because when you feel cruddy for a period of time, when you finally get a label that tells you why, then you feel better. But I want to remind you that IBS is just a descriptor diagnosis. It means that they've ruled out pathology of inflammatory bowel disease. They've ruled out any structural abnormality in your digestive tract. They've ruled out any mainstream infectious agent like Clostridium difficile or C. diff. And really, IBS is that bucket that you kind of get dumped in when everything else has been ruled out and mainstream medicine doesn't really know what to do with you. So again, from a naturopathic perspective, I don't believe that IBS is going to be forever, because once we find and address the underlying cause, bacterial, inflammation, irritation, posture, dehydration, lack of fiber, etc. Once we find and address the underlying cause, your IBS is going to clear up. You're going to then have a balanced digestive tract that clearly knows what its balances, what its boundaries are, and is able to stay in that area. Now, this, because I'm a naturopathic doctor, for those of you who missed kind of the intro, I believe that we're all brilliantly designed and that we have resiliency. And so once we decide you need more hydration than you were getting and then your poop is better, or we need to work on getting rid of some of the opportunistic bacteria in your colon before your gas is going to be non-foul, fermented, putrid again. Once we identify how you're out of balance, we can then do supportive measures to bring you back to balance, and therefore your IBS is going to go away. That descriptor of how your body behaves no longer applies. And so no, you do not have an IBS diagnosis forever. I do believe that it goes away. Many people want to know in how long is it going to take? I have no idea. You are an individual. If you have been struggling with constipation for 30 years, my estimate is that it's not going to happen overnight. And the rough guideline is if it took you 30 years to get here, then give us 30 weeks to undo things. So 30 weeks would be less than a year. I think that's incredibly fair to expect that within a year or so, your body could help rebalance from the 30 years of maybe things that weren't in alignment with your physiology or past trauma or nervous system programming or whatever it might be. And so, yes, IBS can be cured, quote, cured or healed. And really, that's just your body addressing its needs, addressing its foundational issues, and rebalancing and functioning as it is designed to do, which is incredibly well with resiliency. So that's that question. Anyone else have any other questions to ask? I will pause a moment for some ginger tea. A little aside while you're thinking about formulating your questions about poop, digestive tract, or irritable bowel syndrome. I'm drinking ginger tea. So one of the things that I suggested we try between now and the next webinar is the deep belly breathing, 3 to 5 of them before each meal and upon wakening and before going to sleep, 5 times a day. Another thing that I'm going to suggest is ginger. Ginger tea is a prokinetic. What is a prokinetic, you might ask? A prokinetic helps to stimulate the domino effect of the digestive tract. So if all things were happening well and in the way that they're designed to work, your teeth would mash up everything and you would swallow when it's a paste or more fluid. Your mouth has teeth, your stomach doesn't. So you utilize your teeth to chew really well. You swallow when things are a paste. Your stomach digests. Then things pass from your stomach to your small intestine, where everything should be digested into teeny tiny little particles that can get absorbed into your bloodstream through your small intestine. The only thing that should be in the small intestine that's not absorbable would be indigestible fibers that are going to go down and help be broom-like and help bulk up the stool and help feed good bacteria in your lower digestive tract. When this doesn't work, that's when we get symptoms of gas, bloating, indigestion, diarrhea, or constipation. I don't remember why I got down on that, how I got down that road regarding the anatomy and physiology of digestion. What got me down there? I don't remember. So anything that we can do, the prokinetic of ginger, thank you. The idea that things could get slowed or it could take extra long time for our stomach to empty into our small intestine, or it's called transit time, the amount of time from our mouth, the food enters our mouth to the time it ends up in the toilet as feces. That's transit time. If our digestive tract is inhibited in function in any way, doesn't absorb well, doesn't digest well, the fluid balance in the large intestine is off, and therefore things might solidify and get a little impacted in the large intestine a little more than typical. All of those things can influence transit time. Ginger, being a prokinetic, is like helping to make sure that the domino effect of our digestive tract works effectively. And so if someone tends to constipation, we're going to make sure that we pull in very small, easy lifestyle supports so that it's not always about a restrictive diet or another supplement to take. Ginger tea is a perfect example of that. It's warming on these Pacific Northwest damp days. It's warming, and it also helps to stimulate the digestive tract, not in a stimulate evacuation, stimulate diarrhea way, but just very gently, very supportively to make sure the digestive tract continues moving on. The last thing I'm going to mention today is another one of my favorite digestive tract supports. So this is called the castor oil pack. For those of you who follow me on YouTube, if you go to my YouTube channel and search castor oil, CASTOR, there's a video about why to do castor oil packs and a little discussion about how to do them. And basically this increases circulation to your core. By increasing circulation to your core, which is basically your lower ribs and all the squishy parts of your belly, by increasing circulation to your core, you're bringing fresh blood and nutrition into your digestive tract. You're helping to drain any inflammation or irritation away. But most importantly, you're bringing circulation to your core, which helps your nervous system switch from that sympathetic stress response to that parasympathetic rest and digest. Anytime you bring circulation to your core in this manner, you're helping your body come down to a rest and digest state of your nervous system. So, similar to the 3 to 5 deep belly breaths, seeing how much your nervous system is contributing to your irritable bowel syndrome, this is another tool that you can play with 3 to 5 evenings a week, doing castor oil to your belly and seeing if by bringing circulation to your core in the evenings and helping your body to switch towards parasympathetic rest and digest mode in the evenings, you find that your bowels normalize a bit, that you don't quite tend towards diarrhea so much or tend towards constipation so much. If that is the case, if you feel as though castor oil packs to your belly in the evenings help to minimize your IBS symptoms, that validates right there that your nervous system is playing a large role in contributing to your IBS. And so again, if we put you on a therapeutic diet and stressed you the heck out, we'd be working against your nervous system and potentially making your IBS symptoms worse. Questions, comments, please do put them in the chat below. Again, you can choose host and panelists if you just want me to read them, or you can choose everyone if you want any of the guests to read them. I know some of you are on East Coast and some are here in the Pacific Northwest, and some of you I don't know, so welcome. I'm very happy to see your name. I'm just going to kind of wrap up here today and then tell you what's coming next. So we talked about why I care about poop, because I think it's like a window into the digestive tract of your being, and it gives me information about what's going on. And that IBS is a descriptor. It's not telling us anything about the why. You get put in the IBS diagnosis bucket when they've ruled out, they being the conventional medical system, have ruled out everything else that they know what to do with, and then you get in the IBS bucket. Why do I want to look at all of these other things and not just a therapeutic restrictive diet? It's because often, sure, diet plays a role in whether we're pooping or not, absolutely, but it's one player in many. And I would rather have someone look at all of the contributing factors: movement, bacteria, hydration, fiber, posture, nervous system state, history of trauma. I would rather have someone explore all the other causes and contributing factors of the fact that your body is so out of balance. Our bodies are brilliant. They know how to be in balance. We were all born perfectly. And this society and our experiences have put layers on our functioning that sometimes compromises that brilliance. I'd like to uncover the layers, remove some habits or contributing factors so that you can get back to being your brilliant self. No foul, fermented, putrid smell for you anymore. And that we can really build this resiliency in so that you're more likely to stay that brilliant self. So I will be doing these webinars on a monthly basis. It isn't exactly always the third Monday due to life. They will vary a bit. Hopefully by summer, I will find and pinpoint and have them be a regular time each month. But for the next few months, we're going to vary. So follow me on social media. Go to either Facebook or my website, drwendyleewhite.com, and sign up for my newsletter. My newsletter will announce anytime we have a webinar coming up. So there's monthly webinars for you to take advantage of. There will be more YouTube videos coming, so stay there and subscribe so that you'll be notified when new videos are put up. Please do subscribe to my newsletter. That is the easiest way for me to stay in touch with all of my followers and let y'all know what is coming. So I appreciate your being here today. I also have a live event coming up here in May in Portland, Oregon, for those of you who are local to me. So if you're interested in that live event, please do make sure that you sign up for my email newsletter so that you'll get notifications when that goes live and tickets are available. Thank you all so much for coming. I appreciate it. And remember, if there are any questions that you would like answered, please do either message me ahead of time or use the chat box so that we can tailor these to what you need. I am using my education and my experience to tailor this information to what would be helpful for you. If you would find something more in depth about any one of the things that I introed today, just check in and let me know what would be more helpful and what you'd like me to focus one of these months. Today was just an intro, and we'll go deeper each month in each webinar. Thanks so much. I'm Dr. Wendy Lee White, licensed naturopathic doctor, nutritionist, and educator. You take good care and let me know what your poop is telling you. Take care. Bye-bye.